And it was really based on my observations that there's a lot of great work being done, but there's just massive gaps, and they were growing. And then when there's a lot of communities, a lot of our diverse communities, they weren't getting the help they needed. So I came up with a way to try to support them. Our commitment is we will work with you whenever you're ready to go.
Welcome to another thought-provoking episode of Power Talk at PSS BizVerse, where we dive into issues shaping the future of our communities and businesses. Today, we are about to talk about a different subject. No finance, no economics, no marketing. We are talking about a subject that touches every life and it touches it every day. Yet, it remains in the shadows. Yes, viewers, I am talking about mental health. In a world that moves faster than ever, mental well-being is no longer a personal luxury of the rich and famous. It is a collective necessity. From anxiety to trauma to loneliness and burnout, these challenges are all real and they need accessible, compassionate care. And it has never been a bigger issue facing this society. Joining us today is someone who has spent a lifetime, over 2 decades, walking alongside individuals and families going through their most vulnerable times. I present to you Gary Thandi. Gary Thandi has been a student and a practitioner of social work. He did his bachelor's and his master's in social work with 25 years of experience across roles as probation officer, as counselor, as hospital social worker, and as clinical supervisor. Gary has seen the social service system from all the windows. And from this unique perspective, he became the founder and executive director and clinical supervisor of Moving Forward Family Services, a non-profit dedicated to providing low-barrier counseling and support to communities across BC and beyond. Gary and his team work tirelessly to break down barriers and silos within mental health, criminal justice, and education. A widowed father of 2 and a self-described wounded healer, Gary brings deep empathy, lived experience, and unwavering commitment to his work. So Gary, welcome to the show. Gary, please tell us something about your early years. How did you start and move into making this Moving Forward Family Foundation?
Well, thanks for having me. And I was born and raised in Campbell River on Vancouver Island. And I did my studies in social work in bachelor's and master's in social work. I'd worked in victim services. I worked in settlement for newcomers. I worked in adult probation, so adults that had been in trouble with the law and had some conflict with law. And at that point, I had decided, okay, I enjoy this work, but I'd like to work with people before they get to that place where they're potentially going to go to jail, or there's a lot of conflict with the law, or maybe they're ending up in the hospital with mental health, or maybe they've got some significant substance use issues. And so I went back, did my master's, focused on counseling primarily, and then was able to start working at an agency that provides counseling services, a nonprofit agency. I did a bit of hospital social work, did some counseling at a BC Cancer. I had an opportunity to do some qualitative research on intimate partner violence in South Asian communities. And those all gave me the perspective that there's a lot of great work being done, but a lot of massive gaps when it comes to people needing help. And so that's how I came to start Moving Forward Family Services around 10 years ago, a little over 10 years ago. And it was really based on my observations that there's a lot of great work being done, but there's just massive gaps, and they were growing. And then when there's a lot of communities, a lot of our diverse communities, they weren't getting the help they needed. So I came up with a way to try to support them.
That is so inspiring. So, what specific gaps, Gary, do you think you saw that made you feel that there is the need for another organization?
Well, initially it started with that research I did on domestic violence in South Asian communities. And there was a lot of great information from the research, from the literature that talked about the need for services that were culturally responsive, that were in first language. And when I looked at the field, there really wasn't much of that. And there was massive wait lists, or a lot of people were getting turned away. But even not just that particular population, but any population, including even the mainstream population, there were just massive wait lists. So people struggling with anxiety, depression, or other significant mental health or substance use, and they were really struggling. They had to wait a long time to get any kind of support. And if they needed inpatient support, it was even longer often. So those are the kind of things I was seeing, and it was really wearing me down. You know, I was in an agency that, again, does good work, but I often felt like I was turning more people away than we were accepting. And that's when it started to really impact me. Like, I'm looking at reasons to turn them away, not because I want to, but we have limited resources. We have limited funding. We already have massive wait lists, so we have to sort of decide, well, who are we going to support? And I was finding that more and more we were turning people away.
That is so inspiring that you decided to do something about it, because what happens is people see the problem, but they sometimes don't want to be a part of the solution. So your model is the open access, peer supported, donation based model. Can you explain for my viewers how exactly does this work?
Absolutely. So going back to those experiences where I was struggling to turn people away, I had this simultaneous experience. You know, it's based on my own experience initially. Like when I did my bachelor's and my master's in social work, I had great mentors. I had to do a practicum. So part of my graduation requirements was to go into the field and get experience. And these are unpaid, but these are opportunities to apply what I was learning from school into the field and having a mentor, someone to support me. I was finding that the students, you know, I decided when I had enough experience, I was going to take students too, you know, just to sort of pay it forward. And I was so grateful for my opportunity. I wanted to give that opportunity to someone else. And I was finding that they were so skilled because of the quality of the instruction that they were having, that they just needed the opportunity to practice it. And that was the approach I took. I'm going to start an agency that allows these students to practice the way they've been trained, and then I'm going to support them. I'm going to provide the mentorship. I'm going to provide the feedback on their practice. So they're learning, but again, they had so much skill and they had so much energy and so much ability that I wanted to give them that opportunity. So that's really that's how it started. It was basically a frustration with the current systems. It was frustration that when I would advocate for the needs of a lot of our communities, it's not that nobody denied that, but what they would often say is, well, we have nothing in our budgets, right? It's a very restricted model. And so I decided, well, I'm just going to start an agency premised on the strength of these students, and we're going to basically be very transparent about how we do it so people can decide. You know, they can either wait for that other system, or they can pay, you know, a considerable amount of money. Like right now, private therapy costs about $150 an hour. Great if you can afford it or you have great insurance, but a lot of people don't. So we were just very clear, this is the service we offer, and then we let people decide. And then, you know, something I didn't plan for was just the sheer number of students that were coming to us because they were hearing about the opportunities we were providing, which is not just the opportunity to work with clients, but get training, get mentorship, get support, you know, get a very diverse range of experiences. And a lot of those students, when they graduated, they became registered therapists or social workers. They are in the field now, but they value what we were doing, and then they circle back and they start providing sliding skills. So now we have a model where we can offer free services with our student counselors or very low fees, up to $50, for example, with a registered therapist who can, you know, who's more experienced. So if somebody can afford that, then they have that option.
That is so nice, because what happens is generally it is swept under the carpet. The problem is swept under the carpet. So how does your system of self-referral process work?
Well, part of, again, my observation over the years, I call it the window of opportunity. like sometimes somebody will realize, okay, I'm really struggling, and they'll reach out. And so if you turn them away or you put them on a 1-year wait list or longer, then you've really lost that opportunity. That's when they were ready, they reached out and they asked for help. We need to be able to help them at that point. So that's the model we have, is we don't really have wait lists. And so if somebody reaches out, if they, they can call and leave a message. They can go online and fill out their information on a secured, encrypted form. They could have somebody refer them, like a doctor or a lawyer or family member. So we wanted to make it as low barrier as possible. And also part of that low barrier approach is that whatever the condition is, whatever you're struggling with, we have enough people to provide that support. So we have enough, expertise, if you want to call it that, or just enough, different practitioners that whatever you're asking for, we're not going to make you jump hoops. We're not going to say, well, you have to do this first, you have to go here first, you have to go there first, you have to fill out all these forms, you have to show your proof of income. None of that. We're going to just work with the client where they're at and do it at a time when they're ready and they're asking for help.
That is really nice. Now, Gary, as you know, this is a business channel. We talk about business. So last time we met, you talked about the role of mental health in business. So please tell our viewers about your views of the role of mental health in business.
Well, it's, the stats from what I recall is the Canadian economy loses about $50 to $51 billion annually in regards to mental health. So what that means is there are people struggling with mental health and they're not coming to work. Or they are coming to work, but they're not as effective as they can be because of the mental health they're struggling with. Or there's just turnover and sickness. And so in terms of the lost productivity, in terms of the costs, when somebody keeps delaying getting help or avoids getting help, typically the issue doesn't go away. It worsens over time. So now the whatever they're struggling with is just so much worse. And now the support they need is so much more intense, right? And there's cost to that. So those are the kind of costs that are affecting businesses. We see it anyway. Like just in terms of even like the increase in homelessness and in the increase in incidents where there was violent acts, and most people that are struggling with mental health aren't violent, but every so often there are situations where their mental health has become so significant and not, controlled or managed that they may be potential risks to themselves or to others, or substance use and the usage, that's sometimes happening out in the street that's impacting businesses. And of course, no business would, business people care like we all do, but they also don't want to have that impacting their business out in front of their shops. And so there's multiple ways that businesses are affected. And like, again, the productivity of their employees, but also in terms of societally, how people are impacted and how it's going to impact businesses in that case.
A follow-up question, Gary. Now, generally, the business owners are very accomplished people. But as you see the state of the economy, the business owners are increasingly coming under a lot of stress and anxiety. And as a member of many business forums, I'm noticing this is becoming a topic of discussion, the mental health of the business owners. Mm-hmm. So what can we do to improve that?
Well, the fact that we're even talking about this, it was often, not long ago, and in some cases, for some folks, it may still be the stigma, right, to talk about these things. So then they're not talking about it, but it's impacting, again, their potentially their productivity, but if not their health, and it's often manifesting in, maybe not eating well, not sleeping well, high blood pressure, ulcers. And so it is impacting often sometimes the highest functioning, whether they're the entrepreneurs or even the elite athletes. We know these are impacting them. And so what we can do initially is normalize it, to say that we're all impacted. I often say like 100% of us are going to be impacted in some way. We may not have a diagnosed mental health condition, but we're going to go through times where we're going to have bouts of depression perhaps, or experiences of anxiety or self-doubt, or even like grief and loss, we're going to be impacted. We can't get through life unscathed. And so for business people, I mean, I always admire any prominent person that acknowledges that they are struggling, because like I said, 100% of the population also is, but they may be struggling with coming to terms with that, sharing that with their loved ones, and seeking out help. So it can mean many different things for, again, business folks, is either, considering having therapy, and even if you're not struggling, do, as a preventative measure, right? The same way you just go for walks or you go to the gym, it's just to maintain your optimal health. And promoting mental health and well-being within your organization, right? So openly discussing it, talking about ways to, take care of yourself, even, setting a bit of time. What we've discovered over the years is if you just encourage people to maybe, think about these things, they're just so busy that they aren't necessarily able to incorporate it. But if you could incorporate it into your workday, have mindfulness sessions, before you start the day, have check-ins regularly, have open dialogue about, how are you feeling today, and just sharing, that could be massive. You don't need, you don't need to go to therapy if you feel like you're otherwise doing well, but just being openly able to share could make a huge impact.
And I'm sure that the business owners watching this channel will take note of this. And I look forward to inviting you to one or more of our business forum meetings, because this thing needs to come out. One more question, Gary. There is a lot of perceived stigma when it comes to mental health. People don't come forward because they think either they will lose their job, or they will be put in some criminal registry, or they will lose their visa, or God knows what will, or their spouse will leave them, or they'll lose the custody of their children. Can you tell our viewers about this, that not all stress and depression is labeled like that? Rather, I would want you to clarify this.
Yeah, it's something that I've even realized, and I'm speaking more often about my own struggles, realizing that everyone I know has struggled, right? And that's not a bad thing. That's actually a sign of strength and resilience if you can, manage what you've been through. And so I openly talk about my self-doubt, my struggles with anxiety, my struggles with significant loss, that impacted my functioning in my day-to-day. And I was still otherwise, doing the work, but it was really impacting me. And so I'm more open about that. And I think that's part of what we all just need to be more open and recognize, that we are human beings. We are flawed beings, that we are going to make mistakes. We are going to be, we're going to have struggles. That's not a flaw necessarily. That's the human condition. And so openly acknowledging these things, and it will not. I've never encountered a situation where somebody was, maybe in the distant past, where somebody was struggling and it was looked down upon, or, and maybe there's certain segments of that where there's still some definitely work to do around stigma. But I think we've come a long way. I look at my kids and the way, they would come home and share resources from the school, and they were talking much more about stress or mindfulness. Those are things that I didn't do when I went to school, and I didn't have those kind of dialogues with teachers or guest presenters coming in. So we are trending in the right direction. But I think it's really just important to share that this is normal. We will have moments of self-doubt. We will have moments where we're feeling quite down, and we maybe don't even quite know why sometimes, right? Or we're going to have conflicts with people that we care about, and those are going to impact us. Again, that's very, very much part of our human experience. So to me, it's really just normalizing it, and I'm surprised how often now people are so open about it. So again, we're trending in the right direction.
Thank you, Gary. Gary, one more thing. If I have a fever, there is a thermometer that tells me that you have this much of fever. If I have blood pressure, there's a sphygmomanometer that tells me that what my blood pressure is. How does somebody pick up if they are not doing well mentally?
Oh, I think they know it. They just have to be honest with themselves and maybe not, push aside some of those feelings, kind of in some ways embrace that and kind of process that and consider that. I think, like my example, like I lost somebody very important to me, and for years I had to do what I had to do to function and continue to work and live and do everything I did. But it was starting to physiologically impact me. It was impacting my sleep, the quality of my sleep, sleeping less, waking up in the middle of the night, just physiologically feeling sometimes like, okay, almost this feeling of a shortness of breath, but I wasn't, short of breath. So being more cognizant of even like the physiological impacts, being more cognizant of mood, and energy levels, right? These are all things that we could look at. So you're right. There's not just a test like, okay, you put this thermometer or test your blood or anything like that. But it's just recognizing when we're off. And then it also works for our loved ones. If we're noticing that something is different with them, they're more withdrawn, they're less engaged. Maybe there's their sleep patterns have changed. Maybe their eating patterns have changed. So if we're starting to notice those things, you don't have to assume that, they're having bouts of depression or anything. You can just ask, like, I noticed you've been a little withdrawn lately. Are you okay? Right? I think that could be huge as well. Just letting someone know that, you've noticed that maybe something's a little different for them and that you just wanted to check in with them and make sure they're doing all right. And maybe they're not ready to talk to you about it, but at least they know that here's someone that cares and that when I'm ready, they'll be there to chat with me.
That, I hope my viewers take note of that. If you see somebody who you don't think is acting normally, just reach out. Reach out to them and listen to what they have to say. Maybe they don't reach out in the first attempt. Be persistent and just be there for them.
Yeah, and I would just add, in some things that I know it's beautiful, folks are very well-meaning, but sometimes we don't realize when we say, like, oh, what do you have to be sad about? Or what do you have to be, feeling this way? Or it's a beautiful day, just, shake it off. Like, I know sometimes those are well-intended, but realizing that, when somebody's already feeling bad about themselves, those kind of comments sometimes just make them feel worse. Yeah, it's like, yeah, why should I feel bad? But I do, so now I feel even worse. So it's not a criticism. It's very human nature, but it's more important to just let someone know you're available and then be willing to listen. And that's, the less you say sometimes, the better.
So, Gary, what are the biggest challenges you face in a non-governmental kind of an organization setup where you are moving without any funding, without any support? What are the biggest challenges?
Well, a big one is government. It's a system, in my experience, that moves very slowly. It's a very entrenched system. It's a system that, typically will favor one approach, and then it's kind of a one-size-fits-all model. It's not working for a lot of people. It's not working for our cultural communities. It's not working for our LGBTQ communities, our differently abled communities. And this isn't a knock against the people in those systems. They're part of this massive system, and things are just very slow to change. I do get frustrated because we probably see as many people in BC and across Canada as some of these larger systems. And some of these larger, like health, the Ministry for Children and Families, schools, corrections, post-secondary, they're often funded upwards of tens of millions of dollars. And I'm not saying they're not doing the work, but here we are coming with a different model that is much more cost-effective, and we don't get a single penny from any of those sources. And I don't think that's fair. We do get some government funding from other sources, and we're grateful for that. But again, we probably have about 3 to 4 staff, and our output is the equivalent of one of those offices that would have 30 to 40 full-time staff, right? So it's not a fair system, and I will always, until that changes, I'm going to keep, saying we're dealing with a surplus from those places. They're sending us countless thousands of clients, tens of thousands of clients they've sent us since we started, and their systems are more or less the same. So clearly they're not able to manage the load, and then they're sending them to us. So for me, I'm going to keep doing it because I'm passionate about it. I enjoy it. I enjoy the ability to be away from some of those bureaucracies and just really get to the core of what people need. But it should be better funded, right? And so that's a challenge. We get a lot of philanthropic support. We do, social enterprise, like in terms of we have like fees that we charge that helps cover our operating expenses. So, we're doing okay in that regard, but it's more about fairness and equity and funding, in order to do the work that these systems haven't been able to do.
To give our viewers an idea, Gary, can you compare your operations versus any government operations and let our viewers realize what are the scale of operations?
Well, we operate with a lot less bureaucracy. We are much more flexible. So if somebody contacts us and needs a certain type of service, because there's different kinds of counseling and different types of interventions. Again, with a lot of our cultural communities, you can't just take the individual and isolate them. But that's typically what happens in the mainstream services. But by that, I mean sometimes, like say in our let's say South Asian communities, and our South Asian communities are very diverse. So I'm not saying this is the case with all. But sometimes there is this interconnection, right? So if somebody's struggling with mental health, it's also impacting maybe their spouse, right? It's impacting their children, it's impacting their parents, and they all might be living in the household together. So doing family systems type work, family support, instead of just saying, okay, we're going to work with this person and leave everybody else out of it, it's not as effective in those cases. So we're able to be much more flexible. We're able to, like I mentioned at the beginning, if somebody contacts us, there's no service, there's no like checkmark criteria for service. We can support them. If they contact us today, we can get them connected within the day, right? So tomorrow someone will reach out. They don't have to jump through all these hoops to kind of, get a service. So we are just much more nimble in what we can do. We are much more responsive to the communities that we are working with. And I always say, like, I'm grateful for the services we have in the West, but I push against the idea that they're perfect. There's a lot of room for improvement, and we're able to kind of, keep doing what we do and learn from it. Whereas these larger systems are very slow to change, right? And so we're nimble. We're, every dollar we bring in, we can put a lot of it back out because, again, our costs are very low. We have space that's donated to us, which is wonderful and amazing. So a lot of community support. But that's what it is. We're not, like I said, in other jobs where I had to look at reasons to exclude somebody, I don't have to do that anymore. And that part I love. That it's like, okay, here's what you say you're needing, and here's what you're dealing with. Here's the person that we can connect you with. And if it's not a good fit, then we'll find somebody else, right? It's really just that flexibility. We've, had a recent case where somebody had some very specific needs and has some very specific health issues, and they contacted, and I was able to connect to a few other agencies, and we were able to, within an hour, do things that might have taken months to get done before, because there's other people that I love to work with that think the same way, and we can just bypass a lot of those and get to the core of what people need. And be able to get them connected in ways that is so much more prompt and effective.
So, Gary, what is the way forward? What are you thinking? What is it that you want to do to make this even bigger, the moving forward family?
This model is really based on community-university relationships and engagement. Right. So yes, we have these private therapists that are doing amazing work, but the core will always be, how do we work with these student populations doing their masters in counseling or social work, or sometimes bachelors, to meet community needs, whatever that may be. So if something is emerging, we can address it instead of it, keeps getting pushed down the road and then gets worse. Right. That is, again, one of the issues with our system that's very reactive. So continuing to build on the model, as much as I get frustrated that the funding is nowhere where it should be for fairness and equity, I'm not going to let that get in the way. We will continue to expand. We will go. We've already sort of opened ourselves up to Canada, right? And so we'll continue to spread the word, different pockets, different rural communities, different areas, because we have a virtual platform we can use. And then again, we have space in Surrey. So we'll continue to expand. And more recently, we actually were given some use of space, agricultural space. And that's really exciting because as much as I think counseling is important, I don't think it's the only thing. The same way medication is great, but in and of itself, that may not be enough to really elevate the person out of what they're struggling with. It's more of a holistic approach. So it could be medication, it could be counseling, it could be going to get exercise, going for walks, getting fresh air, doing mindfulness, right? Connecting to community. So we're really excited about the potential of this space because it's near water as well, and it's near a park where there's some really nice scenery. And so trying to do more events at this center that we're calling it sort of a health and wellness and beyond center, where people can come, they could do counseling, but they could go for mindfulness sessions. They can maybe do some yoga. They can go for a walk to the park. So this more holistic integrated model. So I'm really excited about the potential there and grateful to the community support that's allowing us to utilize that space free of charge.
I am really excited to see the possibilities in that area. So, Gary, what is the message that you'd like to give somebody who is right now struggling but is not reaching out?
Just again that, hey, I've struggled. I've reached out myself and got help and support. And then there's times when I reached out for a bit and then I kind of withdrew. So that's okay too. Don't beat yourself up over that, right? It's whenever you're ready. But understanding that it's absolutely okay. It's part of the human experience, what you may be going through. Many people are struggling. There's many people struggling with, like they need eyeglasses, right? I do, you do. Like it is what it is. We don't have to, doesn't mean it's a deficit of anything. It's just our vision is different and we need some support. That's the way we need to look at mental health is something is different and I need to address it. And so just not to, whenever you're ready, reach out. That's really ultimately as simple as it is. The window of opportunity. Whenever you're ready, reach out. If you reach out and then you change your mind, that's okay, right? What we always say is, okay, we're available. Maybe now is not the right time, but reach out whenever you're ready. It could be many, many different times before somebody reaches out. And our commitment is we will work with you whenever you're ready to go.
Perfect. One last question, Gary. Now, this is a business channel. We reach out to a lot of businesses. So how can a business that needs to join you in doing good reach out to you, and what is it that they can support you with? How can a business support you?
Great question. I think, we want to work with anyone that has similar values, right? I believe in support the entrepreneurial spirit, right? And I often say, I actually have much more, I think, deeper conversations with business people than I do people in my own field, right? And that's not a knock against people in my own field, but within our field, sometimes we get caught up in this, well, we have no funding. It's a great idea, but we have no funding. Oh no, our funding doesn't allow us to do this. We get so caught up in this box, right? That's imposed upon us in our sector. And yet entrepreneurs don't necessarily think that way, right? They think, okay, how do we make this work? And so businesses, I think I would love to work with businesses that value what we do. We are a registered charity, so if they want to align with us to do different events, of course, we would be grateful, to golf events or, galas. These are all great ways to generate revenues. And our commitment is showing what we do with those revenues and showing how for every dollar we bring in, we're going to put $20 out, right? So it's a model that I think people could get really behind because they see, okay, if I give this funding or if I support this, and this isn't a knock against other agencies, they have cost, understandably, right? So, but in the end, it's almost like for every dollar I give, maybe only 20 cents goes towards the actual service. It is just the reality of the cost of space and the cost of administration. So again, I'm not knocking it, and that's why I'm not saying we're there to replace any of that, right? Those services need to be there. But here we are doing something unique in a very cost-effective way that's reaching a lot of people. If people want to support that, or if they want us to come in and discuss ways that we can support staff, right? So we can reduce absenteeism, we can reduce turnover, we can have, staff that are more productive. If they feel valued in their job site, if they feel like their mental health and well-being is supported, then their productivity increases. So let's talk about ways to bring supports to your business. But also, again, as I mentioned, if they want to just work with us because they feel, we have values that they want to support and we have similar values, I would love to dialogue with them about that.
Thank you, Gary. It was an absolute pleasure talking to you today, because this is something that is very important for the society, because we are eating healthier, we are working out, but this is something that is now slipping behind. And to be a complete person, to be a complete family, to live a complete life, mental health is just as important. So thank you for talking to our viewers. Thank you so much.
Thank you.
Hit that subscribe button and turn on notifications so you never miss an update.